Hello, today we will study about cleft lip and cleft palate. Okay, so what is cleft lip? First, we'll study what is cleft lip. It is the failure, cleft lip is the failure of merging of epithelial grooves between the median nasal process and the maxillary process. Okay, the median nasal process and the maxillary process, they do not merge. The epithelial grooves does not merge there. Second, it may be the median nasal process and the lateral nasal process. The time period in which the cleft lip can occur is between the 4 to 6 weeks of the fetal life. Okay. Now the next part is what is a cleft palate. It is the failure of fusion of palatal shelves and the time period is usually 8 to 12 weeks. For cleft lip the time period is 4 to 6 weeks. For cleft palate it is 8 to 12 weeks in the fetal life. Now as you can see in this picture, cleft lip alone is seen in 25% of cases with male predominance. As you can see here, it is a cleft lip with male predominance. Cleft lip and cleft palate, the combination occurs in 45% of cases where this male to female ratio is kind of equal. Next, cleft palate alone is seen in 30% of cases with a female predilection. Okay, this cleft palate is more prevalent in females. Cleft lip 25% male predominance. Cleft lip plus cleft palate, the association is 45%, which is equivalent in both, kind of more in male, and cleft palate alone is in 30% cases with female predilection. Now what can be the etiology? Etiology can be multifactorial. Polygenic means more than one genes are involved. Non-syndromic with 95% cases and 5% cases with syndromic association, which can be monogenic. The possible causes can be maternal smoking or alcoholism, maternal folic acid deficiency, mother on anti-epileptic drug or steroids when taken during pregnancy. Okay, once again we'll repeat. Etiology for cleft lip and cleft palate is multifactorial, polygenic, non-syndromic in 95% cases and 5% cases syndromic. During the pregnancy the mother is on folate deficiency, folic acid deficiency or alcohol, smoking, anti-epileptic drug if taken during pregnancy or steroids. ठीक है. Next, the genes, as I told you already, it is polygenic in nature. So the genes which are involved, this is very important: MSX1 gene, FGFR1 gene, TGF3 gene, and IGF6 gene. MSX1, FGFR1, TGF3, and IGF6. The diagnosis of cleft lip and cleft palate is done via ultrasound in 15 to 17 weeks in utero. Okay, now some facts of cleft lip and cleft palate. Incomplete cleft occurs when the cleft line interrupted by skin, bone, or both. Median maxillary anterior alveolar cleft, 1% of cases population is seen. Median maxillary anterior alveolar cleft. Precocious limitations of the growth of primary ossification centers on either side of midline at the primary palate. Okay. Next we'll see the facial cleft is most common congenital defect involving face and jaw. Facial cleft is the most common congenital defect. Now what is Patau syndrome? That is trisomy 13. How can you remember Patau? Patausy. When you will spell it, there are total 13 alphabets, and Patau syndrome is trisomy 13. You can see cleft lip and cleft palate. Polydactyly, you can see in this image polydactyly, that is multiple digits are present. Microcephaly, small head is present. Holoprosencephaly, that is brain malformation, and ectodermal scalp defect is seen in Patau syndrome. Okay. Next, very important, cleft lip and cleft palate classification was given by Bue's classification. As you can see in this picture, the class 1 is, it involves only the soft palate. Class 2 involves the hard palate and the soft palate with the incisive foramen. In this picture you can see incisive foramen is there. Next, class 3 is complete unilateral cleft, which involves the soft palate, hard palate, incisive foramen, the lips, as well as the alveolar ridge. And where class 4 is bilateral cleft, which involves the soft palate, hard palate, the lips, and the alveolar ridge, as you can see in this picture. Okay. So once again we'll revise cleft lip and cleft palate. As I already told you, cleft lip is the failure of the fusion of the merging of the epithelial groups between the median nasal process and the maxillary process, or mainly this, or the other reason can be failure of fusion between the median nasal process and the lateral nasal process. The time period is 4 to 6 weeks in the fetal life. The cleft palate is the failure of the fusion of the palatal shells, which is seen in the time period between 8 to 12 weeks. Very important is the etiology. Etiology is multifactorial, polygenic, non-syndromic cases 95% associated, 5% cases syndromic association, which like Patau syndrome. Possible causes I have already discussed. These are the few genes which are very important in cleft lip and cleft palate. Diagnosis is done in the 15 to 17 weeks with ultrasound in vitro. Then as I already told you, incomplete cleft, there is the cleft line is interrupted by skin, bone, or both. Then facial cleft is the most common congenital defect involving face and jaw. Patau syndrome, 13 alphabets and trisomy 13. Views classification: class 1, class 2, class 3, class 4. Class 1, it's just the soft palate. Class 2, soft palate, hard palate, incisive foramen, unilateral soft palate, hard palate, lips, alveolar ridge, bilateral soft palate, hard palate, lips and alveolar ridge. I hope this video was useful. If you have any doubt, you can ask in the comment section. Thank you.